Picture this for a moment. Margaret is 72 years old. She has had Medicare for 7 years. She has paid her premiums every single month on time, without fail. Last Tuesday, she fell in her kitchen. Nothing broken, thank God, but her hip was bruised badly. Her doctor said she needed help at home for a few weeks. Someone to help her bathe, someone to help her dress, someone to cook her meals. Margaret called the home care agency. She told them, "Don't worry, I have Medicare. Please send the bill to them." 3 weeks later, an envelope arrived in her mailbox. She opened it slowly. Her hand started to shake. The bill was for $4,200. Medicare paid zero, not 1 penny. Margaret sat down at her kitchen table. She felt sick. She thought to herself, "How is this possible? I have Medicare. I paid into this system for 40 years. How can they refuse to pay?" If you have ever felt that fear, that confusion, that sinking feeling in your stomach when you open a medical bill, please stay with me. I am Artur. I am a senior policy analyst here at Senior Pension and Benefits Hub. I help retirees just like you understand the rules that most people never explain in plain English. Today, I am going to walk you through 7 things Medicare will not cover in 2026. These are not rumors. These are not opinions. Every single one comes straight from Medicare.gov, AARP, and the Kaiser Family Foundation. And please stay with me until the very end. Because there is one quiet mistake I see seniors make every single week. A mistake that can cost you thousands of dollars, and worse, can take away your right to appeal forever. I will reveal that mistake before we finish. Before I get to the list, let me tell you about Robert. Robert is 68 years old. A retired truck driver from Pennsylvania. He worked hard his whole life. He drove millions of miles. He paid every payroll tax. And when he turned 65, he signed up for Medicare Parts A and B, just like the government told him to. Robert thought Medicare would take care of him. He believed what most seniors believe, that Medicare is like the insurance he had through his company, only run by the government. Last year, Robert's wife Linda started losing her hearing. Doctor said she needed hearing aids. The audiologist quoted them $4,800 for a good pair. Robert smiled and said, "Send the bill to Medicare." The audiologist looked at him gently and said, "Sir, Medicare doesn't cover hearing aids. It never has." Robert was stunned. He thought there was a mistake. He called Medicare. He was polite but firm. He told them, "I have paid into this system for 50 years. The Medicare representative was kind, but the answer was the same. Hearing aids are not covered. Not under Part A, not under Part B, not under Medigap. Robert and Linda had to pull money out of their retirement savings to pay for the hearing aids out of pocket. One conversation, one assumption, $5,000 gone. And here is the painful truth. Robert is not unusual. According to Kaiser Family Foundation data from 2023, 3.5 million seniors on traditional Medicare have absolutely no supplemental coverage. They are fully exposed to every single gap I am about to tell you about. So let me list them. 7 things Medicare will not cover in 2026. Listen carefully. Number 1. Long-term custodial care in a nursing home or at home. This is the biggest one. This is the one that destroys families financially. According to Medicare.gov, and I am quoting their exact words, Medicare and most health insurance, including Medicare supplement insurance, don't pay for long-term care services, including care in a nursing home or in the community. If you only need help with bathing, dressing, eating, toileting, or moving from a bed to a chair, Medicare pays nothing. 0. The average nursing home in America costs between $8,000 and $10,000 every single month. That is over $100,000 a year out of your pocket. Now, there is one exception that confuses many seniors. Medicare Part A does cover up to 100 days in a skilled nursing facility, but only if you had a qualifying 3-day inpatient hospital stay first, and only while you need actual skilled medical care. As soon as your care becomes custodial, the coverage stops cold. Number 2. Most dental care. According to Medicare.gov, Original Medicare does not cover routine cleanings, fillings, tooth extractions, dentures, crowns, or implants. A pair of basic dentures can cost between $1,000 and $3,000 per arch. Major dental work can run into tens of thousands. There are tiny exceptions. If you need a dental procedure that is medically tied to a heart valve replacement, an organ transplant, cancer treatment, or kidney dialysis, Medicare may pay. But for everyday dental care, the answer is no. Number 3. Hearing aids and the exams to fit them. This is what happened to Robert and Linda. According to Medicare.gov, hearing aids are not covered. Period. According to AARP, a quality pair of prescription hearing aids costs between $2,000 and $6,000, and you pay every penny yourself. Part B will pay for one diagnostic hearing test if your doctor orders it to investigate a medical problem, but that is all. Number 4. Routine vision care, eyeglasses, and contact lenses. According to Medicare.gov, eye exams for prescription glasses are not covered. Eyeglasses are not covered. Contact lenses are not covered. The only exceptions are diagnostic eye exams if you have diabetes or are at high risk for glaucoma, and one single pair of basic glasses or contacts after Medicare-covered cataract surgery. That is it. Number 5. Most healthcare received outside the United States. This one breaks my heart because so many seniors finally retire and dream of traveling. According to Medicare.gov, in most situations, Medicare will not pay for any health care you receive outside the United States. That includes Mexico, Canada, Europe, the Caribbean, Asia, anywhere. If you get sick on a cruise ship that has left U.S. territorial waters, you are on your own. If you break a hip in Italy, the hospital bill is yours. Medical evacuation by air ambulance from a foreign country can cost $50,000 to $100,000, all out of pocket. There are a few narrow emergency exceptions, mostly for situations near the U.S. border. But for the vast majority of international travel, Medicare does not follow you across the ocean. Number 6. Cosmetic surgery, routine annual physicals, massage therapy, and concierge medicine. Now, listen carefully to the physical exam part, because this one fools almost every senior. According to Medicare.gov, Medicare does not cover a traditional head-to-toe annual physical. What Medicare covers is something different, the annual wellness visit. The wellness visit is a conversation about your health, a risk assessment, a discussion of preventive screenings. It is not a hands-on examination. If you go to your doctor expecting a free physical, and the doctor checks your heart, listens to your lungs, examines your skin, runs blood work outside the approved preventive list, or treats a specific problem you mentioned during the visit, you will be billed. Many seniors are shocked when this bill arrives. Also not covered: cosmetic surgery, massage therapy, and the retainer fees charged by concierge doctors. And if your doctor has officially opted out of Medicare, you owe 100% of the bill yourself with no Medicare backup. Number 7. Routine foot care, most chiropractic visits, most acupuncture, and gym memberships. According to Medicare.gov and AARP, routine toenail clipping, callus removal, and corn treatment are not covered unless you are a diabetic with documented peripheral neuropathy. Chiropractic care is covered only for manual spinal manipulation to correct a documented subluxation. Anything beyond that, x-rays, massage, maintenance visits, treatment of your shoulder or knee, is not covered. Acupuncture is covered only for chronic low back pain that has lasted at least 12 weeks, up to 12 visits in 90 days. All other acupuncture is excluded. And gym memberships, fitness programs, and weight loss programs generally not covered under original Medicare. Now, I know this list sounds frightening, so let me share what protects you. According to Medicare.gov, you have specific rights every senior must know. First, you have the right to receive an Advance Beneficiary Notice of Non-Coverage, also called an ABN, before a provider gives you a service Medicare will likely deny. This is Form CMS R131. If the provider does not give you this form before treatment, you may not be responsible for the charge. Second, you have the right to appeal any denied claim through 5 levels, all the way up to federal court. But you must file your first appeal within 120 days from the date on your Medicare summary notice. Third, Every state operates a free counseling program called SHIP, the State Health Insurance Assistance Program. You can call 1-877-839-2675 or visit shiphelp.org. They will sit down with you and review every gap in your coverage at no cost. Fourth, Medicare Advantage plans, also called Part C, often include dental, vision, hearing, and gym benefits. But please understand, these plans use networks. They require prior authorization. They limit your geographic flexibility. They are not free, and they are not the same as original Medicare. Fifth, if you are low income and need long-term care, Medicaid is the safety net. PACE programs may also help seniors 55 and older stay in their communities. Now, here are the 3 exact steps I want you to take this week. Step 1. Go to Medicare.gov and search the official What's Not Covered page. Print it. Read it twice. Highlight the items that affect you. Step 2. Before any non-emergency procedure, ask your provider directly, will Medicare cover this? If not, give me an ABN form so I can decide in advance. Never assume. Always ask. Step 3. Review every Medicare summary notice as soon as it arrives. If something looks wrong, file an appeal immediately. Mark the date on your calendar. You have 120 days, not 1 day more. And now, the hidden mistake I promised to share. The biggest mistake I see seniors make is throwing away or ignoring their Medicare summary notice. According to Medicare.gov, once 120 days pass from the date on that notice, your right to appeal that specific claim is gone forever. Permanently. No exceptions. No second chances. I have seen seniors lose thousands of dollars because they assumed a denial was final. It wasn't. Roughly half of all properly filed Medicare appeals are decided in favor of the patient. But you must file in time. Please, do not throw those notices away. Open every envelope. Read every page. Check every charge. If something feels wrong, call the number on the notice or contact your SHIP counselor. Before I let you go, please remember something important. Medicare rules change every single year. The information I shared today is accurate for 2026 based on Medicare.gov, AARP, and KFF. But by next year, some rules will change again. Do not rely on YouTube notifications. Do not trust what your neighbor says. Do not trust what someone at church tells you. The only sources you should trust are Medicare.gov, SSA.gov, AARP.org, and Kaiser Family Foundation at KFF.org. Bookmark these websites today. Visit them once a month, and whenever you are unsure, call 1-800-MEDICARE or your state SHIP office. Your health is your wealth. Your savings are your dignity. And the only way to protect both is to understand exactly what Medicare will and will not pay for before you get the bill, not after. If this video helped you, please subscribe to Senior Pension and Benefits Hub and turn on the notification bell. But more importantly, share this with your spouse, your brother, your sister, your neighbor, anyone who has Medicare and might be one assumption away from a $5,000 surprise. I am Artur. Thank you for spending this time with me today. Take good care of yourself, take good care of your family, and I will see you in the next video.